I'm Dr. Aboufares, and I am the founder of OMNI Medical of New York. For the last 9 years, we've treated about 8,000 patients based on the premise of providing quality as the mainstay of therapy. We've been lucky to have been affiliated with major university teaching hospitals in New York City, most recently with New York Presbyterian since 2011. Currently the practice is affiliated with Columbia University and also with the Northwell system at Lenox Hill Hospital. We have 5 physicians on staff, and we have a practice that has a scope of all the way from primary care and telemedicine all the way to endovascular and surgical procedures, example of vascular surgery. I'm proud to have a PC or a medical practice that has the 3 disciplines of endovascular therapy under one roof, basically vascular surgery, interventional radiology, and interventional cardiology. For the first time ever, we have a medical platform where the 3 disciplines are under one practice, where we can provide the patients with all kinds of vascular therapy, whether it's open surgical in a university hospital setting or whether it's an endovascular minimally invasive done in an office setting. This had proven a lot of success among our patients. They are very comfortable with the range or the scope of therapy in between office procedures all the way up to a hospital procedure. We believe in a patient-centered therapy, and all what we do is basically going to revolve around the patient being in that center. All of us, whether it's the front desk, the medical assistants, the phlebotomists, the sonographers, the physicians, are all going to approach the patient from different angles, basically, or different perspectives, and the patient will leave the office with probably one of the best outcomes from their end.
Generally, I am very perceptive with how you are being received, especially by medical clinics, because some medical clinics are very impersonal. It's not easy to find a doctor that has a kind of personal relationship with the patient, because you can feel the compassion, the care, and really efficiency. So you know that when you come here, you will be treated well, not just by Dr. Aboufares, but also just entering the reception desk with all those women, the ladies, the staff, Leah, Jackie, Mildred. It makes a lot of difference because they are friendly faces and they really make you feel comfortable.
He has a pretty good sense of humor, and but he is, and I've known him a few years, but he is good at what he does, and he's established a deep level of trust, and yet still engages me on a human level, even though a lot of the stuff is so technical and very pinpoint accuracy. So I really enjoy his conversations with me.